he has to have insulin, and by an insulin pump it gives the patient much more versatility in how they administer their insulin. They don't have to carry their insulin injections with them, and they can just simply dial in how much insulin they want on the pump, and then the pump will give it to them. This case was very special for the fact that the patient did not know English and I did not know Spanish, and we actually have to communicate multiple times throughout the day. For instance, we'll communicate when he wakes up, before he eats breakfast, before he eats lunch, at dinner time. A lot of times I'll have them wake up at 3 a.m. To actually check their blood glucose, and because it wasn't as easy to communicate, that created a little bit of difficulty, but we were able to figure out ways that we can actually communicate and keep the patient safe during this time, and actually everything went very well.
How many times a day are you measuring your blood sugars?
4 veces al día, salidas.
4 veces.
4 times.
Okay.
Edgar, our interpretive services expert, Edgar actually came and met Javier from the beginning through the end of his training, which was months on end. Edgar had to learn all of the terminology of diabetes and insulin pumps. He's a medical translator, so he knows all the words, but he had to learn the meaning to be able to translate that training for Javier.
History, basal, configure. The pump now has menus that are in Spanish, and that brings yet another angle, and that is the provider himself or herself would have to be able to look at the pump and figure out what the settings were in Spanish, because now the pump would only be in Spanish.
It's all in Spanish.
What we do here is we integrate that information into the patient's day-to-day. We learn what their lifestyle's like, and we teach them to problem solve. So we teach them how to think like an educator. And when they leave here, they've got the confidence and that safety that we know they're going to get the best care, and also that they're going to be able to really succeed with that pump, because it's truly just a piece of machinery without good education.
Now that we've done one, I think we've established a way that we can actually accomplish this more frequently. So I foresee us doing more of these insulin pump starts in Spanish and possibly other languages as well going forward.
I know there are others in the same situation where it will make it easier for them to also acquire a pump now that I have received mine. I am satisfied with the fact that people like me, Hispanics who speak Spanish, have been taken into consideration to have this pump or utilize this pump so that their quality of life might improve as well.
This definitely was a big team effort. Multiple people were involved with this, and if you were to tell me a year ago that we'd be doing this, I probably would be skeptical the amount of work that this took, but a lot of teamwork involved, and it actually went out very well.
I'm really proud to have a job where I can meet patients like Javier and work with people like Edgar and Dr. Kidia and Rob Baum, who really are invested in thinking about each person as an individual, and letting education take a big part in that is really touching and it's very meaningful to me.